everyone, I am Monica de Guzman, a student nurse from Davao Doctors College. And so for today's video, I'm going to do a female catheterization and, and to and urinary catheterization is a hollow tube is inserted into the bladder to drain or to collect urine. So okay, without any further ado, let's get started. So in performing the procedure, first we have to check the doctor's order for the catheterization. So it is to ensure that we have the right patient and the right procedure to be done. And of course, next we have to wash our hands. We have to do the medical hand washing before we prepare the materials needed. So in performing the medical hand hygiene, it is to deter the spread of microorganisms. And in preparing the materials needed, it is to save time and energy as well. So I have here the catheterization set of catheter, the 10cc syringe, the sterile gloves, the cotton balls, the tape, and the lubricant, antiseptic, and the sterile water. And of course, I have a forceps and a urinary bag and catheter. Good day, ma'am. I am Monica de Guzman, your student nurse for today. And so for verification, can you state your name, please? Okay. Can I see your wristband? Alright. So, I'm just, before anything else, what do you want me to call you? Okay. So, for today, we're going to do the procedure of catheterization as ordered by your doctor. So, inserting catheterization will reduce your acute urinary retention. And of course, in order to do this, I'm going to expose your genital area to do the completely do the procedure. Would that be okay with you? Alright. Thank you so much. So before anything else, before we start, do you have any questions, clarifications? Alright, thank you so much. Next, we have to provide privacy by screening or closing the room, and of course position the patient in a dorsal recumbent with the knees flexed. So with this, good visualization of the meatus is essential to the catheter. Gravity will aid the flow of the urine when the bladder is higher than the end of the catheter. Drape the patient, exposing only the area to be used. Embarrassment and chilliness will make the client become more tension, and it may interfere the easy introduction of the catheter. Next, we have to apply the direct light of visualization of genital area. Open the tray and arrange equipment for convenience rather, and accordingly to avoid contamination of sterile items. Placing the equipment in order will increase the speed of performance. Reaching over sterile items increases risk of contamination. Using the sterile forceps, cleans the area using the cotton ball with betadine, and thorough cleansing would prevent contamination. Next, that we have to open the set of serving sterile technique. Put on the sterile gloves to prevent contamination and to maintain the sterility of the set. Next is that we have to put the eye sheet. I already put the eye sheet. Lubricate the catheter for about 1/2 inches, being careful not to plug the eye of the catheter. So lubrication reduces a friction and urethral trauma, that reducing pain of the insertion of the catheter. Pick up the catheter at least 3 inches from the tip of the thumb. Place the thumb and one finger of the left and right hand between the labia minora. Separate and pull up gently. Separating the area surrounding the meatus provides visibility. Next, we have to insert the catheter in the meatus for 2 to 3 inches until urine will begin to flow. Relaxations of the external sphincter aids is easy insertion of the catheter.
A specimen is to be collected. Pinch the catheter with thumb and finger while placing the specimen container in position. Urine will flow out in the catheter if lumen is not occluded.
Next, we have to rest the hand in the pubis area while holding the catheter in place to prevent pulling and pushing of the catheter. Withdrawing the catheter and pushing it back in the urethra increases the possibility of contamination to the urethra. Connect the urine bag, and then the urine bag will not leak from the and we will not leak and maintain the sterility. So next, we have to inflate the balloon about 10 to 15 cc of sterile water using a 15 to 20 cc syringe, making it sure that there will be no leakage of water from the balloon. Thus, it serves purpose of anchoring into the bladder. So, secure the indwelling catheter by tapping it to the patient's thigh. Allow some slack of the tubing to accommodate the patient's movement. So, this is to secure the catheter properly, and then slacks prevent tension on the catheter when the patient moves. Next, we have to position the patient into a comfortable position to foster relaxation and comfort. Next, we have to do the aftercare, and we have to document. We have to record the time of the procedure done, and of course the color of the initial output.